Now, I'll be going over this in a bit so you'll understand if you're balanced or if you're not balanced. So here you have down here, you see this is the white blood cell count, and the white blood cell count comes in basically 5 different categories. So if you look up here again, so if you're looking up here, so we have the white blood cell count, which is right here. And then the white blood cell count is made up of 5 different components. 1, neutrophils, 2, lymphocytes, 3, monocytes, 4, eosinophils, and 5, basophils. So you have the white blood cell count, and if you look all the way down here on your blood panel, and this is kind of a standard blood panel, you'll see the different components of your white blood cell. So this right in here is your entire immune system, and all these numbers here, all these neutrophils, lymphocytes, monocytes, eosinophils, and basophils represent what is your total white blood cell count, just to orient you to that. Now, when we look at your white blood cell count, the neutrophils, lymphocytes, monocytes, eosinophils, and basophils, this is kind of like what they look like under the microscope. So you can see clearly that they are different. They look different, and when they look different, they actually have different functions. So different components of your white blood cell in your body do different things depending on what's happening in your body. So this down here breaks down what each of these things do. So we have your neutrophils. So the neutrophils is really for bacteria. So if you have a bacterial infection, generally your neutrophils are going to go up. Now, if you have a viral infection, your lymphocytes are generally going to go up. And then here, if you have your monocytes, I don't know if you remember the kissing disease or mono, right? The kissing disease or mono, your monocytes go up. And then your eosinophils, if your eosinophils are elevated on your white blood cell count, this can indicate that you have some kind of parasite, small bacterial overgrowth. So on a functional level, when you look at the subset of the white blood cells, it can kind of give you an indication of like what's happening in your body.